Emergency department closures in Ontario have soared to a new record. Staffing shortages forcing ERs and other critical healthcare facilities to close almost 1,200 times so far this year. That's according to a new report from the Ontario Health Coalition, the advocacy group calling it a crumbling healthcare system. 868 emergency department closures, 316 urgent care center closures.
These closures are staggering. The numbers are like nothing we've ever seen before.
2 outpatient laboratory closures, 1 ICU closure, and 1 labor and delivery unit closure.
They mean, without question, that people's lives have been put at risk.
The total, nearly 1,200 closures across Ontario of vital healthcare services between January 1st and November 24th. The equivalent of 30,000 hours of care lost, according to the Ontario Health Coalition's newest report.
3 years ago, emergency department closures were completely unheard of. In my 27-year career, there's been maybe one that I can remember in all those years. So they're getting more frequent, they're getting longer.
One of the most high-profile closures in Minden, Ontario. With their ER now permanently closed, the closest access to emergency services is in Haliburton, 25 kilometers away.
It's like there's this overall community sort of gasp of, what if I fall? What if grandma falls? What if my grandson, falls off a dirt bike? It's a community on the edge of, and it's fear. It really is fear.
The Ford Conservative government just doesn't seem to care.
The NDP leader challenged the government with the findings during question period.
The Ontario Health Coalition blames these closures on, and I'm going to quote them, unprecedented failure of leadership by this government.
It is disruptive for a community, but that is exactly why our government has made such a conscious effort and investments in our hospital systems. In last year's budget alone, we had an average increase in our hospital budgets of 4%.
I think the minister is totally out of touch. She's spinning a good line, but it's not reflecting the reality of what Ontarians are experiencing out there.
A spokesperson for the Minister of Health adding the government is investing $44 million to help keep emergency rooms open, but opposition leaders say they want the government to cancel its plan to move more OHIP-covered surgeries to private clinics and instead use that money to fund the public system. For City News, I'm Tina Yazdani.